2, and go.
Hello. Thank you for joining us for today's Colorectal Cancer Awareness Month in Orange County. My name is Carol Burkett. I'm the Deputy Chief of Staff for Orange County Mayor Jerry Demings. I'm excited about today's program as we educate and bring awareness about colorectal cancer in our community. I'd like to begin by thanking our sponsors that have helped make this program possible. The American Cancer Society, Orlando Health Cancer Institute, Advent Health, Community Health Centers, and True Health. Today's program will include remarks from the American Cancer Society. You're also going to hear from our medical professionals and a story of survival that I know that will inspire others. It is now my distinct pleasure to introduce our Orange County Mayor, the Honorable Jerry L. Demings, to begin this morning's program. Thank you, Mayor Demings.
Thank you, Carol. Good morning, everyone. It's a pleasure for me to be with you virtually as we recognize National Colorectal Cancer Awareness Month and Dress in Blue Day here in Orange County. I want to thank our partners, the American Cancer Society, for co-hosting this event with the Orange County government as we increase awareness about colorectal cancer. I also want to thank our healthcare partners for their support. For those who are joining us through social media and the web, I hope you are all dressed in blue like me. During this morning's program, we are going to hear from the experts about what each of us can do to prevent colorectal cancer and the importance of early detection. According to the American Cancer Society, in 2021, it's estimated and 149,500 people will be diagnosed with colorectal cancer, and over 52,000 people will die of colorectal cancer. It is the second most common cause of cancer death in the United States. Before I read today's proclamation, I would encourage each of you to take the information that will be provided by our experts and share it with your family, co-workers, and friends. It is up to each of us to spread the word and raise awareness. And now, as I transition to reading the proclamation reads, whereas Orange County, Florida, proudly celebrates National Colorectal Cancer Month in an effort to bring greater awareness to colon cancer, and whereas colon cancer is the second leading cause of cancer death in the United States when men and women are combined, and whereas 1 in 23 men and 1 in 25 women will develop colon cancer in the United States, and whereas during 2021, 149,950 new cases of colon and rectal cancer will be diagnosed in America, and more than 52,900 deaths are expected. And whereas to help combat this devastating disease, a screening is recommended for individuals who are over the age of 45 and those who have a family history of colon cancer. And whereas Orange County has joined forces with the American Cancer Society to encourage more people to get screened regularly to help save more lives throughout Florida and the nation. And whereas continued education and increased awareness regarding early detection are key to prevention, thereby ensuring future generations have the knowledge and tools to prevent the disease, allowing for longer, healthier, and happier lives. Now, therefore, I, Jerry L. Demings, by virtue of the authority vested in me as Orange County Mayor, do hereby proclaim March the 22nd, 2021 as Colorectal Cancer Awareness Month in Orange County, Florida, and encourage all individuals to work together to promote awareness and understanding of colorectal cancer and the importance of early detection. Again, I do say the month of March, done and ordered this 22nd day of March 2021. Sign yours truly. We'll make sure that the proclamation is delivered to the American Cancer Society to share with your partners. It's now my pleasure to turn the program over to Maria Cabrera, Senior Director, Cancer Control Strategic Partnerships for the American Cancer Society, for your comments. Carol.
Thank you, Mayor, and thank you, Maria, for joining us. And you are recognized. Look forward to hearing from the American Cancer Society on the importance of Colorectal Cancer Awareness Month.
Thank you, Carol. On behalf of the American Cancer Society, I want to thank the Orange County Mayor's Office for today's proclamation. This month of March is about generating awareness about colorectal cancer and the importance of prevention and early detection. We at the American Cancer Society want to remind you today that getting screened for colorectal cancer can prevent and detect cancer early. Despite the challenges we faced this past year with the pandemic, colorectal cancer remains a public health priority, and we must provide the public with safe opportunities to prevent and detect colorectal cancer polyps and cancer early. Emerging research is already revealing many cancers are going undiagnosed and untreated in the wake of COVID-19. Together, we must act vigorously and relentlessly, not only to mitigate, but to reverse these alarming trends in cancer screening and care. The American Cancer Society has joined efforts with the National Comprehensive Cancer Network and other leading health and cancer organizations to encourage appropriate cancer screening and treatment to save lives from cancer. If you have delayed or avoided medical care because of the pandemic, talk to your doctor today about safely resuming care and your next steps. Colorectal cancer screening can save lives, but only if people get tested. Talk to your doctor today. We at the American Cancer Society recommend that people at average risk of colorectal cancer start their screening at age 45. Talk to your healthcare provider about the screening options for colorectal cancer and when you should get started. This is even more important if you have family history or other risk factors for colorectal. For more information about colorectal cancer and other cancer screenings, please visit us online at cancer.org or call us 24 hours a day, 7 days a week at 1-800-227-2345. And now it is my pleasure to introduce Dr. Mohammed Tajani, the Medical Director at Appen Health Cancer Institute Colorectal Cancer Program. Dr. Tajani earned his medical degree from Dartmouth Medical School and completed his residency at Yale New Haven Hospital in New Haven, Connecticut, achieving the rank of chief resident. He then went on to complete his fellowship in hematology and oncology at Fox Chase Cancer Center at Temple University in Philadelphia. As an award-winning physician, Dr. Tajani has authored numerous oncology-related publications. His research experience and areas of interest include gastrointestinal cancers, biomarkers and therapeutics, patient-provider communication, and the culture of medicine. Dr. Tajani firmly believes that patient care is a privilege. Listening and responding to a patient's unique story is critical in helping that family on their cancer journey. Dr. Tajani.
Thank you very much, Maria, for that kind introduction. And thank you, Mayor's Office, to invite me to be part of this very, very important program. I'm going to try to share my screen with everyone. And so, as was discussed earlier today, what is alarming about colorectal cancer is it is one of the cancers that is increasing in incidence quite significantly in the United States and in Europe. The reasons for this increase are certainly currently unknown. There is a lot of research happening in that space, whether it is a dietary issue or an environmental issue. But what is absolutely clear is that the rise in colorectal cancer is predominantly in adults less than the age of 50. This is the reason why the screening guidelines have been reduced to the age of 45. But as has been urged, really anyone at any age, if they have any alarming symptoms that we will review today, please seek out your primary care doctor and discuss whether colorectal screening would be appropriate for you. The reason we are all stressing this is that colorectal cancer is one of the few cancers that is preventable. We have very, very good treatments for colorectal cancer, both surgical and medical, which is what I focus on. But our hope and prayer by doing awareness work this month is that you don't need us at all, and are able to prevent the colorectal cancer, because these tumors start as benign polyps that can be detected. Symptoms that I want you to watch out for, and certainly with yourself or your loved ones or your friends, anyone who has these symptoms, these are uncomfortable to talk about, but so important to bring up to your physician. Any change in bowel habits, more erratic, more frequent, more urgent, change in the size, anything that is not a typical pattern should be brought to the attention of your primary care physician, and be your own advocate to ask your physician whether colorectal screening is appropriate for you, especially if there is a family history. Any bleeding with your bowel movements, whether it's bright red blood mixed in with your stool, or dark maroon blood that is coming up from higher in the colon, anything that is persistent, I would recommend getting screened. Lower abdominal pain, especially in the lower area of the abdomen that is cramping or significant, I would also recommend discussing that. And then very worrisome if there is unexplained anemia or weight loss. These are all symptoms that should be brought to the attention of your primary care physician to discuss whether screening for colorectal cancer is appropriate, because indeed there are many screening options. Colonoscopy is the one that is used most commonly. This is where they're able to evaluate the whole colon. The advantage of a colonoscopy is if a pre-malignant polyp is found, it can be treated with a colonoscopy by removal, thereby removing the risk of progression to cancer. There are other less invasive methods of screening if a procedure is not right, and these include fecal DNA testing. And so again, while we have made great advances in the treatment of colorectal cancer, and it can be cured if caught early, you will be hearing from a cancer survivor as part of the program today. But what is really important that the mayor and Maria have all stressed is that you can prevent colorectal cancer. Take your health in your own hands, discuss whether screening is appropriate, and if you have any symptoms, please speak up. How this is, however uncomfortable it is, it could save your life. It is my now distinct privilege to introduce to you Leslie Johnson. Leslie has walked the journey of colorectal cancer, and he's kind enough to share his experiences with us today. He is the father of 2 adult children and the proud grandfather of 1 grandchild, and started his journey in December 2019. And I look forward to hearing his experiences.
Thank you. My name is Leslie Johnson. I'm an over-the-road truck driver. I'm 40 years old. As the doctor said, I was diagnosed in 2019, December of 2019, with stage 3 colon cancer. I pretty much consider myself a healthy man at 39. I worked out constantly, ate well, took pretty good care of myself. And but going to the doctor really wasn't part of my routine because I consider myself healthy. It wasn't until I began to see blood in my stool and told my wife about it, where she urged me to go to the doctor and figure out what was going on. When I went to my doctor, he suggested a colonoscopy where they found cancer. And I had surgery and went through chemo, both radiation and infusion. And I'm proud to say that I'm currently cancer-free at this moment.
Thank you. I know you go by Les, right?
Yes.
I think you prefer Les, but such a wonderful story. And I hope that that's an inspiration, because I think so many of us do think we're healthy. You know, we try to eat right, get our exercise in, and but you certainly didn't ignore the signs that you saw and took immediate action, and that is why you're here with us today and looking great, by the way. So
Thank you.
congratulations. So I'm just
Thank
going to
you.
do my hand clap. I know there's a virtual somewhere, but I'm going to clap for you and for your family, because I know that that was probably something difficult to go through when you go through chemo and radiation. You need your family around you supporting you. So congratulations on your great health and looking wonderful and sharing your story. I think that's what's so important. So others will go ahead and do what, as Dr. Jajani said, early detection and getting screened is so very important. It is now my pleasure to bring back Mayor Demings as he provides some closing remarks for today's program. Thank you, Mayor Demings.
All right, thank you, Carol. I'd like to thank all of our speakers for the valuable information that you have shared this morning, and special thanks to Les for sharing his experiences. We are so glad to see you are doing well. As we close out the program, I hope you will take some time to explore the resources available at the American Cancer Society webpage and connect with our health partners on any questions you may have, and most importantly, scheduling a screening. As you have heard excuse me, as you have heard this morning, prevention and early detection are key to saving lives. On behalf of the 1.4 million residents who call Orange County home, thank you for participating in today's program. Have a great day and rest of the week.